Hello and welcome to Public Health Network Cymru's podcast. I'm Helen Green.
And I'm Sarah Nanwa.
In this episode, we'll be visiting two community development offices in Caerphilly. Over the past few years, Ross and Kerry have been working for the Communities First initiative, which addresses health inequalities in the areas of Wales with the highest levels of deprivation. The pair have varied roles, but one of the projects they're most passionate about is supporting people with mental health issues.
Mental well-being is defined by the World Health Organization as a state whereby individuals recognize their abilities, are able to cope with the normal stresses of life, work productively and fruitfully, and make a contribution to their communities. The scope of the mental health agenda in Wales includes the promotion of mental well-being and the prevention, treatment and recovery of mental illness.
The community members that Ross and Kerry work with have varying degrees of mental health issues. We went to their offices in the Mid-Valleys West area of Caerphilly County Borough to find out more about their work. Good morning, Ross and Kerry. We're here at Caerphilly Council to talk about some of the work you do in the community, especially around mental health. So could you give us a bit of an outline of your role to start off?
Yeah, thanks Helen. My name is Ross Thomas. I'm here with my colleague Kerry Smith. We are Community Development Officers working for Gwent Association and voluntary organisations under the Communities First programme in Caerphilly Council. And part of our development role is to work with a range of participants and community groups. It involves community cooking sessions, support to community groups, funding and guidance, and working with a range of participants really. And we also heavily come across mental health issues in our everyday work as well.
Yeah, my name is Kerry Smith. I'm the Development Officer for Mid-Valleys West Cluster in Caerphilly Council. As Ross has just explained, we are development officers, and development means in my eyes that we cover quite a lot of areas of work and mainly develop people on the sort of early stages, as I call it, of helping to support whatever needs that they require. Myself, I've been working with a lot of mental health projects and groups within the last couple of years. We try to tailor a bespoke package for clients that we're working with that are suffering from mental health, as opposed to sort of just meeting with people now and again, giving a little bit of advice and sort of walking away. We like to spend time with people, nurture people, refer and link up with other organisations to get the best outcomes and the best support for the people that we're working with. Going back to the bespoke sort of service that I was speaking about, when I say action plans and things, I'm talking yearly action plans for people. It's not something that we just sort of pick up and work with someone for a very quick short time. We long term, and some of the things that we put in place for people to meet on a regular basis is weekly colouring groups where people come along, have a little chat, get things off their mind, feel that they're in a safe environment, they can talk about their problems and any issues they're facing. Weekly craft sessions. We've also arranged a series of training for people that we are working with, including British Sign Language, first aid at the workplace. And I believe that all these sort of interventions that we are putting in place are really having a massive impact on the people within the community that are facing mental health issues. And the feedback that we get from the clients that we work with is just mind-blowing, really.
And what do you think is the biggest misconception within mental health?
I would say the biggest misconception is that generally people don't have enough knowledge or understanding around what mental health issues or problems are and the different types of mental health issues that people can face. And I think the biggest thing is as well is that if you have a physical health issue, you can see it and people will relate to it or understand it, whereas mental health, you will have certain side effects and things that can be sort of visible to the eye, but generally a lot of it is what's going on inside you, so that people can't see that you're generally unwell, so people don't understand and they can't relate to it. That's what I feel is the biggest thing.
I think it's important to remember as well that everybody has mental health and mental well-being, whether it's poor or whether it's good. And I think the current statistics suggest that 1 in 4 of us at the moment through our lifetime will suffer from a mental health issue or a breakdown from a mental health issue. So I think it's about realising that mental health affects everybody, whether, as I said, whether it's poor, whether it's good. And it's really important that people have their mental health and well-being at the forefront of their minds, and just respect and understand those around them who may not have the level of self-esteem or the level of confidence that they have. So as Kerry said, I think it's about being understanding and being sympathetic, and just having that general overview that everybody has mental health.
Yeah, and I think just adding on to that as well, one thing that I think is for someone to come forward and actually ask for help and support, and that they're worried that they've got mental health problems that they're dealing with, that is such a courageous thing to do, because we all have busy work lives or family lives where we have the odd day where you think, I can't cope anymore, this is too much pressure. Is there a light at the end of the tunnel? And I think, generally people do sort of having experiences of mental health ongoing throughout their lives. But I think that it's about people standing out and actually recognising that, they've got to face an issue that they're dealing with. And I think it's really brave and courageous of the people that come forward for the support.
I think just to touch on stats again, I think it's proven that the vast majority of people who have recognised themselves as suffering from poor mental health are actually keen to get safe, secure, long-term, well-meaning employment, whereas maybe the misconception is that people with mental health simply don't want that. And I think that's probably one of the biggest misconceptions we come across in the employment services and support that we offer as well.
Yeah.
How do you think these misconceptions have come about, and how do they affect the people who've got mental health issues?
I think one of the major problems is not, for one, the media has a big thing to play in it. For example, when it comes to sort of like random attacks and killings and things like that, they always like to mention, if there's a mental health aspect to it, and people get drawn into that, and it's not true, because in actual fact there's a very, very small percentage of things that happen in the world and the country, and it is come from someone that's suffering with a mental health issue. There's total misconception. So the media sort of doesn't really play a good part in that. And the other thing as well is I just don't think there's enough awareness of what mental health issues actually mean. And I don't think people understand it. Every day you walk into the doctors and you see advertisements about the flu or different things like that. But I think there needs to be more advertising and more awareness done around mental health.
Yeah, and just to touch on what Kerry said, I think it's widely agreed that the mental health aspect of the National Health Service has tended to be the sort of Cinderella, if you will, of the National Health Service, in so much as not receiving the attention or the funding that it needs. I'm quite positive that is changing at the moment. And I think it's about realising that there's a job of education in this as well, in so much as people need to realise and learn about mental health and mental well-being, and that sometimes, you will be affected by poor mental health, but that's fine. But it's about realising there are support networks, whether it's Communities First, whether it's Mind Cymru, whether it's Time to Change, whether it's Gofal. There are so many support organisations out there that perhaps people are not aware of, and certainly in the work that we do, in collaboration with the partners I've just mentioned, that people are aware and recognise that there is a support network out there. That's not to say that there isn't work to be done until we've probably captured everybody in the cluster that we work in. There will always be work to be done to ensure that people recognise that there is a support network out there.
Yeah, I think it's just key that there's been a stigma attached to mental health, and that just needs to be really seriously broken down.
If you'd like to be involved with future episodes of this podcast, please get in touch by emailing publichealth.network@wales.nhs.uk or tweeting us at PH Network Cymru.